Welcome to the Science of Skin Health on Legends 100.3, brought to you by JoAnn Francis Medical Aesthetics Spa, helping you put your best face forward. Here's Mike McGann and clinical esthetician and licensed skincare specialist JoAnn Francis.
Good morning and welcome once again to the Science of Skin Health right here on Legends 100.3. The Science of Skin Health is brought to you by JoAnn Francis Medical Aesthetics. My name is Mike McGann. And with me today is clinical esthetician JoAnn Francis herself. Hello, JoAnn.
Good morning, Mike. Good morning, listeners.
And happy Sunday to you. I want to go ahead and give you some quick information about how to get in touch with JoAnn Francis and JoAnn Francis Medical Aesthetics and get your free clinical cosmetic consultation. I'm going to be getting one done soon. We're going to talk about that in shows to come, but I'm looking very, very forward to that. And there are a number of things to celebrate today because it's Easter today. It's April Fool's Day today. It's my wedding anniversary today. There's an awful lot of things coming together, and so it's going to be a fun show. Very exciting. So happy Easter to you. Glad that you are with us. JoAnn's number is 561-616-1001, 561-616-1001 to set up that free consultation. You can also learn more at francismedesthetics.com. That's Francis, Francis, Medesthetics, Medesthetics.com. And, if you would like to get a question answered on a future program, you can send that question to JoAnn directly. JoAnn, JoAnn, at francismedesthetics.com. All right, JoAnn, I know there's a lot to cover today. So let's get to it.
There always is, but it's always fun. And happy Easter, everyone. Happy April Fool's Day.
Absolutely.
And happy anniversary.
Why, thank you.
You're very welcome. So today's show title is kind of continuing part two of what to choose.
What to choose, sure.
So last week we talked about, what to choose when it comes to products, because the ingredients really is what makes a product do its thing. So that's kind of what we base on what we should look for.
Sure.
And they work for your specific needs. So with essential ingredients that are at a professional prescription strength.
Right.
And when I say what to choose, it isn't for the client to worry about or try to figure it out, because we've been doing that. And what to pick during my consultation at JoAnn Francis Medical Aesthetics, we discuss it together. So what are your skin issues and concerns? Then my knowledge and my studies. I show you what ingredients and in what combination of how they, how the protocol works, will correct and maintain a healthy skin.
Okay.
So we kind of talked about last week a little bit tretinoin, which is Retin-A.
Right.
And tretinoin has profoundly beneficial effects on the upper and lower layers of the skin. And it deals with acne and aging.
I remember being on some Retin-A when I was younger because I had some of that typical high school acne when I was a kid. And Retin-A was something that did help me out in that case.
You know what? And it still does. It is such a gold standard in the industry for acne. But then a lot of people that had adult acne back then realized it was also helping with wrinkles.
Okay.
So now it's very big for anti-aging.
Anti-aging as well, sure.
Yeah.
In this area especially.
Yeah. So I want to talk about another prescription, another essential ingredient that we use in the Zeomedical protocols. And it's really important knowledge because, like most prescriptions, it is very specifically prescribed for optimum results.
All right.
When overused or not used within a very specific regimen, then there can be adverse reactions or even no results.
I think that makes sense when you're talking about any prescription, any kind of a prescription regimen. I mean, you don't want to take too much or too little. You're going to get the instructions on how to use it, and you're going to follow those exactly. I mean, that's how we use antibiotics. That's how we use all the others.
Exactly. We always follow a prescription.
Follow the prescription, yeah.
Never stop the prescription too soon.
Right.
Even
use
though
it till
you
it's
feel
done,
better.
Or there's a lot of rules that go into this.
Exactly. And it's all based on science, very specifically. So, yes, again, this is why I study Dr. Zain Obaj's very specific science, because it works when it's used properly. So the next essential ingredient is called hydroquinone.
Okay.
So hydroquinone is commonly used in dermatology, and it treats the condition of hyperpigmentation, which is brown spots and melasma. It's also HQ for short, but it works by inhibiting overproduction of melanin. So we have melanocytes. They get very excited. Their job is to protect us.
Okay.
So they get very excited. And within the proper protocols to obtain a more even distribution of the melanin that's being produced inside the cells and stops them from bunching up and appearing as brown spots.
You get a little, it just distributes them a little more evenly so they don't get, well, yeah, what we referred to in the past as age spots. But if you've listened to this program, that is actually issues with melanin, and that is a sun damage thing.
Exactly. So when we were younger, it used to be a nice even tan.
Right.
So what happens with melanocytes is as we get older, they kind of bunch up, almost like like ever go to a party when you're an adult and you kind of gather in corners.
Sure.
That's kind of what they do. They kind of bunch
analogy.
up.
I see that.
Yeah. That one just came to me. So very important. Hydroquinone is very specifically placed. And the duration is very specific and important in Dr. Hossein Obaji's Zeomedical protocols because, and I have seen this a lot, Mike, when new consultations that have come into me and they've been on hydroquinone for a long period of time, it can do the opposite. And it can cause skin darkening. So I had a client that came in just this past Friday, which I get a lot. They were put on a specific hydroquinone from somewhere else without any supportive ingredients for a very long time. So to no avail, she got no results.
Wow.
And this becomes very frustrating and very expensive for people. So I guess it's kind of like a computer. It can be very frustrating when you don't know how to use something and you've spent a lot of money on it.
Right. Well, that's so true. But as we said earlier, if you're getting a prescription, if you're getting these products, and the protocols to follow, and you follow them correctly, that's where the results come in.
Yeah,
the computer analogy
yes.
is also a great one because I do things with audio editing, or when it comes to working on cars, anything along those lines. If you know what you're doing, you're going to get the results that you want if you follow the correct steps.
Exactly. And what happens when you purchase a car or computer and you don't read the instructions and try to figure it out on your own?
Oh, well, we could begin with, do we even know where the key goes? I mean, there are so many, there's a right way to do things. And when you do it right, you get the results you want.
So with JoAnn Francis at JoAnn Francis Medical Aesthetics, you get the instruction sheet.
Get the instruction sheet, right? Exactly.
So the darkening of the skin from overuse of hydroquinone is actually called ochronosis,
All right.
where the skin can even look bluish or even black in certain areas.
Wow.
So the recommended use of hydroquinone in Dr. Hossein Obaji's protocols is actually limited to about 4 to 5 month period.
All right.
And then switching to non-hydroquinone protocols at the professional level, it's essential to maintain your results, but also continue the results. It doesn't like you just stop, you actually continue to get more results.
Okay.
So for very stubborn melasma, pulse therapy can be done again with hydroquinone, but only after a break is given to the cells.
You need to find out more about it because this could really work for you. Come in to JoAnn Francis Medical Aesthetics, get your free cosmetic consultation. I'm going to, and see if the medical protocols are right for you. If you've got discoloration, uneven skin tones, really, men, women, all skin tones, this can help with all of them. Call 561-616-1001, 561-616-1001, and find out, can that tone be evened out? Can those spots be dealt with? They've got everything you need.
It's very true. Thank you. With Zeoskin Health, hydroquinone is not the only approach that can be taken, including treatments that we offer at JoAnn Francis Medical Aesthetics. And you heard me talk about this, such as IPLs and lasers.
Right.
And these treatments can be limited depending on skin tone. So Zeomedical Health and Zeomedical protocols, they are for all skin tones. So at JoAnn Francis Medical Aesthetics, we do specialize in men and women of color and from all over the world. So, it's kind of like this, Mike. When you're driving on 95, if you're going, let's say, 65, 75 miles an hour, what would happen if you just stopped?
Well, the law of inertia would mean that everything in your car is going to continue going at the same rate and everything's going to crash. You might go through the windshield. Again, it's not a good situation.
Exactly. So another very important note on hydroquinone. It should never just abruptly be stopped. It should be slowly transitioned into a maintenance regimen. And this is to eliminate the overexcitement of those production of melanocytes, which can reverse all the results achieved to that point.
Now, that actually makes me, this is timely because, right now it's a crazy allergy season. People are getting all kinds of allergies and sinus infections and a lot of things, right? And everybody gets a Z-Pack now, and when you get the Z-Pack, and a lot of times there's also people with prednisone, it's a kind of a combination. You get weaned off these things.
Definitely.
You finish them out, but the doses get lower and lower.
Exactly.
Otherwise, you can have some pretty bad reactions to it, or it just doesn't have an effect. And that's what this is making me think of. I just did that like 2 weeks ago.
Yes, exactly. This is exactly the same thing with hydroquinone. Because what's happening with hydroquinone, and I'm going to get a little bit more into this, with his protocols, one of the products with it kind of just puts the melanocytes on vacation. Again, I was talking about this, why we clean up the skin.
Right.
So if you just stop that, they're going to be like, oh my God, I'm going to overproduce and get too excited.
Right.
So the results are amazing. And when used in proper conjunction with the supportive ingredients, it balances a healthy skin barrier while it goes through the transition from the old dead skin to healthy skin, healthy glow.
Right.
And we all want that baby skin. And I can help you achieve it.
So, by the way, call the number because that's how you can learn more about it. Find out how JoAnn can help you specifically with your skin type, with your skin tone, with your skin issues with a free cosmetic consultation. Call 561-616-1001.
And the last note on hydroquinone. In its proper protocols through Zio Medical, it is essential to use it at least 6 to 8 weeks before getting any certain peels and lasers for proper skin conditioning. First, to reduce the risk for developing over-hyperpigmentation, or PIH, which is post-inflammatory hyperpigmentation.
That makes a lot of sense because the things that we've been talking about, if you're doing a peel to get rid of the pigmentation, and then what you've been talking about, the peel could get the melanocytes excited. I mean, if I'm not mistaken, right?
Exactly.
And you'd want to have that under control first.
Right. So that's what I try to do. I try to let it make sense and why when I recommend something to somebody when they come in, which again, even a consultation I had right before I came over here the other day, it was specifically to explain to the people why what you're even using hasn't been working.
Right.
So yes, and just as important, to continuing on the protocol afterwards as well. Skin care is an ongoing commitment. We don't just stop aging. And sun damage that appears on the skin, it can be over from 20 years ago.
Right.
So just like the gym or eating right for weight loss. You go on a diet or you work out at the gym. You don't want to just stop it abruptly. You want to continue and maintain your results.
Right.
So many times, Mike, I have clients that come in and say they have been on hydroquinone before and it didn't work.
Right.
And this is why. It's that Ferris wheel. But when you see results, it does motivate you to continue.
It really does.
Isn't the same thing with weight loss and going to the gym?
Absolutely. All of those things.
So Dr. Zaino Baji just takes correction to a whole new level. While cleaning up the pigment, this is seen as brown spots, melasma, and at the same time, if you do not put, like I was just saying, those melanocytes on a timeout, then you're going on that Ferris wheel and they're continuing to produce at the same time that you're trying to clean them out.
It reminds me a bit. I'm thinking about giving my son a bath when he was a little bit younger.
Yeah.
And, he'd splash and I'd have to clean it up. And it's kind of making me think water overflows. And if I don't turn the water off and leave him in there to keep on splashing, then it's just going to keep on slopping out over the top. I have to kind of stop it at the source if it's going to do any good.
Right, because otherwise you keep trying to clean it up while it's
There's
over.
more just coming out.
That's a great analogy.
Go through a lot of towels and mops that way.
That's a great example, plus a lot of extra work.
That's so true.
So we live in Florida. We're very lucky to be able to have fun in the sun all year round. So you can still enjoy your lifestyle and benefit of living here in paradise while reversing skin damage and protecting the skin from further damage.
Okay.
So years ago, when I was growing up, there really was not so much knowledge given on how the sun causes skin damage and premature aging. We weren't told, or I didn't listen, about sun damage. Don't we feel invincible when we're young?
I remember the exact same thing. Dad always said, wear this SPF or put a hat on. And I said, oh, I'm fine. I was like 13 to 18,
Yeah, we feel invincible.
We do.
So now, at least through Dr. Zaino Baji's ongoing science studies, we can reverse the damage.
And give a call for that free consultation at JoAnn Francis Medical Esthetics. The phone number is 561-616-1001. 561-616-1001. The website is francismedesthetics.com.
So I was watching some professional golf last week and the week before. I noticed the skin of those golfers and their sun damage. And some still are really very young.
Oh, yeah.
At JoAnn Francis Medical Aesthetics, I have some pro golfers and golf instructors that I have gotten on the Zeo protocols for reversing that sun damage and preventing the further sun damage as well, and to prevent premature aging. So, yeah, you can have the best of both.
And I want to also point out, golf is huge here, but boating, boat show just happened last weekend, and tennis players, a lot of outdoor activities like that. I figure that that would probably go for them too, right?
Absolutely. So yes, and it does not have to be on the most aggressive protocols. There are protocols that will help you without downtime as well. So come to see me at JoAnn Francis Medical Aesthetics. See the amazing results that I can help you achieve with your skin.
Absolutely.
So remember, Mike, that we were talking a couple shows ago about SPF.
Oh, absolutely, yeah.
So remember Zeo Skin Health SPF protection. It goes above and beyond also with the most comprehensive range of sun protection available, with the added ingredients of plant-derived melanin, which is not washed off or sweated off as readily as other ingredients in some sunscreens, which wear off in about 1 to 2 hours.
So you're out there working, or golfing, or on the boat, you're sweating,
lawn
or swimming,
work,
whatever
yard
it may
work.
be. There's plenty of ways to get that washed off or sweated off, and so the plant-derived is going to last a bit longer then.
Exactly. So with additional protection in Zeo Skin Health sunscreens, you have longer protection, including additional antioxidants for DNA protection and repair.
Okay, great.
So the variety is available, and it is great with sunscreens that are hydrating and give you luminescent look to the skin, to one with a primer, which also includes skin tightening peptides,
All right.
to one that gets deeper in color as you rub it in to match any skin tone with a bronzed glow.
That's very
That's
useful.
just to name a few. And his body sunscreen spray provides non-greasy, weightless feel and is an aerosol-free can.
Oh, wow.
So you can even apply it to your own back. You can spray the can upside down.
Really?
Yeah, because it's
wow,
kind of in
that's
like a
huge.
bag that's inside
Right.
the can. So you
I
can spray it
getcha.
outside. So in case you don't have anybody with you that would be willing to put the sunscreen on your sweaty
Sure.
back.
But, that's
or
it's such a
anybody's.
pain to have that. Well, that's great. Sprays upside down. I love it.
And have you ever put sunscreen on, Mike, that you missed a spot?
Yes.
And you get marks?
Yeah, that's happened. I've had interesting shapes.
Me too.
It'll help us get away from it. That's a great idea.
So in another interesting piece of knowledge on the opposite note, the opposite of hyperpigmentation, which is brown spots, or sun damage, there's also something called hypopigmentation.
Okay.
Or the lack of pigment or loss of skin color. And this skin appears white.
I've seen that happen. I have a couple of those from when I was a kid, actually.
Yeah, and this is not just from sun damage. So there are many causes of hypopigmentation. One, the most common cause can be from injury, such as a burn.
Right.
Sometimes permanent, sometimes temporary. You do also see it in sometimes surgery. If people get facelifts and stuff, you can see white areas.
Okay.
So albinism, which is very rare.
Right.
It is a congenital disorder characterized by the complete or partial absence of pigment in the skin, in hair, and even in eyes. When lack of pigment in the skin is in patches and sizes and shapes that can vary, one can be diagnosed with a disease also called vitiligo.
Right.
So vitiligo is a condition characterized by patches of skin losing pigment and can be on any location of the skin. Vitiligo is an autoimmune disease. There is no cure, and it is usually a lifelong condition.
I never realized that was autoimmune.
Now, there is new things, though, that come out, so you might want to see a dermatologist that is
Okay.
actually maybe does continue science on vitiligo. So there is some new lasers and things that can be done as well.
Wow, that's great.
Yeah, it's interesting. Another reason for white areas can be called tinea versicolor,
Okay.
which is caused by a fungal infection or yeast.
Wow.
And while sun damage is usually associated with hyperpigmentation, excess UV exposure can also cause loss of color. So a lot of people do see some white pigment on the skin because it actually burns the melanocytes.
Interesting.
Yeah, so although some causes of hypopigmentation are irreversible, first check with your dermatologist to get a diagnosis of the cause and possible treatments.
I had no idea there were that many things that could cause that hypopigmentation. That's fascinating.
Yeah, and that's why I give knowledge, honestly, because you don't want to just treat something without knowing the cause of it.
Well, I'd imagine, there are going to be different things that would help with each one of these. You have to get to the root causes before you can actually figure out what the fix is.
Yes. So if they are white spots from the sun, where the spots are permanent, and if you have white scars, let's say, again, from surgery or something, let's say you had a mole removed from your dermatologist, there is something that you can do about it.
All right.
At JoAnn Francis Medical Aesthetics, I specialize in something called micropigmentation or medical tattooing to repigment with skin tone.
Just like it sounds then? I mean, just like a tattoo.
Exactly, it is. But it's something that I specialize because it's more of a makeup end of it where it is the same technique, different machine, same technique though. It is a tattoo.
Wow.
So very important to know that I am certified and licensed through the Florida Department of Health. This is the law and it is for all tattooing. If the skin is broken and pigment is placed in the skin, including permanent makeup, microblading, all of that, which is what I do, it is a tattoo.
Wow, that's really something.
And it does fall, under the Florida Department of Health. I have to have a tattoo establishment license. I have to have a tattoo artist license. I work under a medical director, and I do have to have, by law, a biomedical waste permit. This is for everybody's health and safety.
Well, you've got all the bases covered when it comes to that. It's just so interesting to know all the different titles and all the education that you have. But it allows you to do all this and have all these options and know they're going to be done right.
I have to sleep at night. I have to do right by everybody, and I do it by exactly what is supposed to be done.
It's certainly, well, everything comes together with it, and that's the reason that you need to have that consultation at JoAnn Francis Medical Aesthetics. It's a free cosmetic consultation, and you can call 561-616-1001, 561-616-1001, or you can visit francismedaesthetics.com. Like I said, I'll be getting a consultation, and I'm looking forward to it. So definitely check it out, 561-616-1001. Now, there's something else to check out as well, something very cool, literally. Wow, that was actually kind of an accident, but something very cool is coming up. Let's talk about it.
Yes, and don't miss this. Everybody write this day and time down. We're having a cool sculpting event. And like I said, when it comes to the science of looking good for the body, we don't want to struggle with unwanted fat. And, even if we work out or we exercise or eat well, there's going to be certain areas of the body, men and women, that we just have that fat we cannot lose.
Under my chin drives me crazy.
It's exactly, because you know what? That is always visible. Sometimes clothes can cover things up.
Sure. I used to have a goatee, and that helped. Now that that's gone, there's no hiding.
And women choose not to have the goatee to cover it up. So
probably for the best.
That's a certain area. But like I said before, for women, it's all areas. It's bra fat, upper arms, abdomen, inner thighs, outer thighs, knee fat. There's so many areas. Men, we know, stomach, spare tire. But yeah, the chin fat. That's extra fat is not cool, but cool sculpting really is cool. And the date is April 12th. Thursday evening from 5 to 7. Come to JoAnn Francis Medical Aesthetics. It's going to be very informative. There's going to be nibbles and drinks. We're going to see a live demo, get all your questions answered. But it's to transform your body, and it's without surgery. There's no downtime, and it is proven safe and effective.
What's just briefly what would cool sculpting feel like? I'm so curious about that. I know we'll learn more about it at the cool sculpting event, but what's it like? How does that work?
It's very interesting. It's really not a painful procedure. Everybody's level of discomfort at times, but when it's applied, you feel it. The skin starts to get very cool, very cold, because it's actually freezing the fat. Right. So there's about 5 minutes of what I kind of call like achy feeling. Okay. And then you go numb. And we actually have a big screen TV, big TV. You come in, you can watch Netflix, you can watch movies while you're getting the treatment done. We can even get you lunch while you're getting the treatment done.
Wow.
Yeah.
So it seems like it's so simple, and you can learn a lot more about this, learn just how cool sculpting really is at the Cool Sculpting event at JoAnn Francis Medical Aesthetics. It is Thursday, April 12th, and you said 5 to 7 p.m.?
5 to 7. And Mike, please call and make your reservations. Space is limited, and you really do not want to miss this event.
Make that call, 561-616-1001, 561-616-1001, or visit francismedaesthetics.com. Register for that cool sculpting event, or set up your free cosmetic consultation. You'll enjoy it. JoAnn is great to talk with. I have a great time on these shows, so it's one of the reasons that I really want to go and get mine done as well. So 561-616-1001 is that number. FrancisMedAesthetics.com is the website. And if you have questions, something that we have not talked about on the show, something that you heard JoAnn say and say, I missed that, or wow, I'd like to hear more about it, or even just something that's like, I wonder, get in touch with JoAnn. Send an email to JoAnn, JoAnn, JoAnn at FrancisMedAesthetics.com. That's Francis, MEDESTHETICS.com. And we'll address that question on a later edition of The Science of Skin Health right here on Legends 100.3. Wow. Well, there was a lot we covered today.
Interesting.
It really, really was. So once again, happy Easter and happy April Fool's Day. And there's no April Fools involved here. We're not kidding. It's a free consultation. The Cool Sculpting event is legit. It's all wonderful stuff. Call JoAnn Francis, 561-616-1001. And make sure you tune in again next Sunday for another edition of The Science of Skin Health with JoAnn Francis and me, Mike McGann, right here on Legends 100.3. JoAnn, have a great day.
Thank you. Have a great Easter.
Thanks for listening to The Science of Skin Health on Legends 100.3. To learn more about how JoAnn Francis Medical Aesthetics Spa can help you put your best face forward, set up your free consultation today. Call 561-616-1001 or visit FrancisMedAesthetics.com. See the difference JoAnn Francis can make. Tune in next Sunday at 7 for another edition of The Science of Skin Health right here on Legends 100.3.